Fellow Kenyans, going by the COVID-19 statistics of the last few weeks, which we have been sharing with you daily, you will notice that the disease continues to surge in all the 47 counties. A fortnight ago, we did not have anything to report on West Pokot, Samburu, and Baringo counties. But as you're now aware, the virus cases have been reported everywhere across the country. The increase in cases should be a clear reminder to Kenyans that COVID-19 has not gone away, not even with the warm weather season, which is slowly approaching. It is important for all of us to remember that in order to be able to combat this virus, it all comes down to individual decisions that each and every one of us is making to keep himself and others in the community safe. Now, turning on to our COVID-19 statistics, today we have recorded 515 new cases, raising the country's total to 29,849. The new cases were drawn from a sample size of 6,353 collected within the last 24 hours. Of the new cases, 496 are Kenyans, whereas 19 are foreigners. The youngest is an 8-month-old infant, and the oldest is 92 years old. With regard to distribution by county, Nairobi leads with 251. Kitui comes in second today with 41. Kiambu, 33. Kericho, 23. Kisii, 19. Bomet, 19. Nakuru, 18. Homa Bay, 16. Laikipia, 12. Murang'a, 11. Migori, 10. Nyeri, 9. Uasin Gishu, 8. Kajiado, 8. Mombasa, 7. Lamu, 5. Narok and Busia both have 4 cases, whereas Embu has 3. Machakos and Nandi also having 3. Nyandarua, Wajir, 3 again, and Kakamega, 2. We have provided the distribution in terms of county segregation, and that will be availed to you. In terms of our recoveries, we have 672 patients who have recovered from the disease, bringing the total number of recoveries to 15,970 so far, of which 65 are from various health facilities, whereas 607 are from the home-based care program. And we would like to thank our healthcare workers for this great achievement. Sadly, 7 more patients have succumbed to the virus, bringing our fatalities to 472. Na tunaendelea kutuma rambirambi kwa jamaa na marafiki ambao wamepoteza wapendwa wao. It's important to note that Kenya has employed mechanisms when it comes to screening that are actually endorsed through the World Health Organization. And yes, you're correct that it may be that sometimes the use of a thermogun might not be able to pick up a positive case. However, different studies have shown a level of utility for putting in place these screening services. And so we feel that following the guidance from WHO, we shall continue to adopt this, particularly in areas where there's a lot of human traffic in the malls, in the airports. This is a measure that can actually be useful, particularly for the most, afflicted patient who is demonstrating the high fevers and other symptoms. Yes, it is true. 90% of our patients are asymptomatic, meaning we would possibly miss them through that mechanism, but that does not invalidate its use because you could also possibly pick a positive case. With regards to Nancy Okwaro's question, I'll ask Dr. Kuria here, who will add on to this in terms of the response. As we were preparing our brief for today, I'm informed that there's actually now an upsurge when it comes to normalization of cases. We're happy to report for antenatal care services. It seems mothers have now started going back. We're happy to report even for deliveries in a hospital. Mothers have started going back to deliver in a hospital. Particularly impressed with MTRH, Eldoret Hospital, where their surgical bookings are continuously now coming back to normal. So yes, Kenyans have had, but we need to emphasize and remind them that these services are available and that they should not be afraid.
Studies done by the Ministry of Health through the month of March through June, through May, had shown an initial decline in attendances in hospitals, and there are several indicators that were used to do this analysis. And most of them are based on OPD attendance, first ANC attendance, and the first three doses of DPT given to children, and the number of children under 5 presenting to hospital, and also the number of children presenting with pneumonia-like symptoms. There was an initial decline noted in these cases through the months of between March and May. But between May and June, there has been shown an increase or improvement in attendance in these facilities. So as proof indeed that indeed Kenyans are heeding to our call that these services are available and they are safe. Of note is an increase in the number of what you call skilled deliveries of pregnant mothers and delivery of children. There had an initial decline through May, but a slight increase between May and June. Bed occupancy rate has also declined, and you're seeing now an slight increase in bed occupancy across all referral hospitals. Of importance here is to encourage Kenyans, as it here indicates, to continue seeking these services in our facilities. They are available, they are safe, and more so for surgery, where there are initial studies and initial recommendations against surgery. We are continuously encouraging surgeons to continue doing their surgeries and taking extra precaution, of course, as they conduct their surgeries. So I'm from a hospital right away, and I've seen a case actually in theater, and surgeons actually conducting their surgeries as usual as we speak. So surgeries are indeed ongoing, and they are safe, but what we're encouraging surgeons is to ensure for elective surgeries, play safe, at least do a COVID-19 test before elective surgeries. But for emergency surgeries, as long as you take your precautions, put on your mask, N95 mask, and also the patient, the abnormal thing here is, I'm a surgeon myself, and all I know is initially, or before COVID, we never used to advise to have patients wearing masks. But today, our patients are also wearing masks, just as the surgeons. So the surgeon wears an N95 mask, or the patient wears a surgical mask. But yes, these surgeries are safe, as long as the surgeons take precautions, even when they are not COVID-19 tests, especially for emergencies.